Hello, I am Susan Harshman, and I'm a dental hygienist here in Centerville, Iowa. And Mrs. Spurgeon asked me to just take a second and give you an idea of what it was like to be a dental hygienist. I've been a hygienist for 33 years, so obviously I like my profession, or I probably wouldn't still be doing it. Some things you should know. Right now in high school, you want to make sure you are taking all the math and sciences you can, because if you don't love math and sciences, dental hygiene is not going to be for you. Also, too, you want to make sure that you get your foreign language in while you're in high school, because it's so much easier to do it in high school than when you get out into the college arena, because most of those people have already taken foreign language, and it's just so much harder. Each college is different. I had to have 2 years to get into the dental hygiene program, but if you should ever want to go on to dentistry, I know sometimes they require up to 4 years. So make sure your guidance counselor checks out what school you're kind of looking at and thinking about, because it's so much easier, again, when you do it in high school. The things that you needed to do to get into dental hygiene school once you were out of high school, in my day, you had to take what was called a DHAT. It's just basically an aptitude test to see if you were ready to go into dental hygiene and if you would be academically eligible and ready to go into that program. And it also places you on the school's list of how soon you can get accepted into their program. The higher up you go in your aptitude test, obviously the higher you place and the sooner you get into the program. Most dental hygiene programs do have a waiting list, so that's something to think about too. Once you're in college, the way it went for me is I had 2 years of undergraduate study at the University of Iowa, and then I went into my dental hygiene program and actually finished it in DMAC. At the end of that, you also get to take boards, and they rate you on your clinical skills and also on your academic skills to make sure that you learned something while you were in college and your parents didn't waste their money. But even though it sounds scary to take national boards, it's also very rewarding, because it does let you and your future employer know how you actually did while you were in school, and that you're ready to go into the you're ready to go into your professional field. Also, too, you are going to keep up those skills by keeping up your license. That takes 30 hours of continuing education, and we do that every 2 years. It's good for your patients to know that you're staying current, and it's also good for you because things change. I will tell you, things are so much different now than they were 30 years ago when I started. My actual skills that I do in dental hygiene is I am actually the person that physically works on the patient. I clean their teeth, I x-ray their teeth, I give them education on how to maintain the oral cavity. I screen for oral cancer, and just basically anything that's going to help them go on, because basically your mouth is your gateway to your overall health, and I think most people tend to forget that. Most people don't tend to associate that brushing may also be leading to many other physical conditions you might have. So I think that's usually an eye-opener for most patients. The other thing I think is very important with dental hygiene is you have to be a personable person. You have to physically love those patients that are coming in your office, because if not, it's not a very pleasant atmosphere for you, and it's not a very pleasant atmosphere for your patient. You want to treat them just like your family, and honestly, they do become your family. You cry when they have things that happen to them, plus you also rejoice when things happen with them. So it's a very personable profession and very family-friendly. I had the luxury of being able to work part-time when my kids were little, and now that they're off in college and graduated, I work a few more hours. You should know, professionally and financially, dental hygiene is probably a better program for you to go into versus dental assisting, because the fact you see your own individual patients, you will basically command a higher salary. I make $39 an hour, and I know it's probably double of what an assistant makes. The difference between me and an assistant is, again, like I said, I see my own individual patients. They're under my care. Dr. Harshman has to be in the office to check them and check them for cavities and do all the operative work that needs done. But the assistant is the one that sits with Dr. Harshman in his office and helps hand him instruments and those kinds of things. Not to downplay their importance. They're very important, but they're not physically hands-on working on the patients. Let's see what else Robin asked me to talk about. The actual working conditions in my office. I think our office is very pleasant and personable, but it can tend to be, some dental offices are tiny in scope, and you sometimes are in a very enclosed room. So those are things to think about when you're interviewing. Is this an office I want to work in? Do I have some windows in my operatory? Is everybody in this office a team player? We have a small staff, and so again, we're kind of a family. So when you interview, those are things that would be very important to find out. A typical work day for me is 8 to 4. I work Monday, Tuesday, Thursday, and Friday, so I'm only working 4 days a week. Over my career, I've worked various hours. Usually they're typically 8 to 5, Monday through Friday. Again, when my kids were little, I was done at 3, so I could pick them up from school. You can kind of dictate your own office or your own hours because you're basically your own boss, sort of. Each dentist is different to work for, and I've just been fortunate that I've worked for the best over my career. Patients vary. We work on toddlers all the way up to people that are almost 100 years old. So you might start your day off with a screaming 2-year-old that doesn't want you to look at your mouth or look at their mouth, and end it with a very older person who's 90, and they're just so grateful to, one, talk to you, and two, still that they have their own teeth or most of their teeth, and that they're a bright spot of your day too. They're challenging as far as scopes of practice on them. I have some patients that have never been to a dentist. I've had patients that come regularly every 6 months. I have patients that maybe haven't seen a dentist for 30 years. So my day is always different. I look at my work as a challenge. I definitely, like I said earlier, love my patients, and I want to definitely make sure that they are getting the best of care and the best of me. I do want to close by saying, no matter what field that you go into, make sure you go into it with passion. It's up to you to make your day a great day or a bad day. You choose. You choose to be happy, or you choose to be kind of a crappy individual. So I think it's so much better to choose happy. I wish you great success in whatever career you choose. If you want to know more about the dental hygiene field, just have Mrs. Spurgeon get a hold of me. She's got all my personal contacts, and I wish you just the best of journeys down the road. Thank you.